So first, a little bit of background. We all know that cognition is a very critical aspect when it comes to health as people begin to enter the later stages of life. And it has like social, economic, and health-related consequences. And then also we know that it's influenced by a myriad of different factors, such as an individual's mental health, their exercise and physical activity, their relationship status, and of course, fundamentally their age. And then in addition to this, there's a large and vast literature that has identified and looked at associations between education and cognition throughout the life course. But with that, there's a lot of mixed opinion when it comes to education and cognition in the literature that I found. So like whether education is a correlational factor, like is it just associated with things, or is it a causal factor? And in terms of issues that are associated with this, like major empirical issues, there's confounding due to factors such as family background. So to account for this, typically one can look at siblings, although data limitations have not always allowed this technique in general. So the main crux of this paper is to examine how sibling differences in education are related to difference in cognition in older age. So to do this, as some of our colleagues earlier said, they used the UK Biobank, but just in case anyone is not aware, it's a study of about 500,000 participants, 37 to 74, recruited between 2006 and 2010. Our main outcome in this paper is cognition, which is measured by the summation of 13 logic puzzles that can be answered correctly by the respondents within about 2 minutes. A slight limitation that I'll touch on later is that this information is only known for about 200,000 of the UKB participants. So in terms of our education levels, they were measured by mapping each qualification and imputing an equivalent in terms of years of education. And then our sibling pairs for the genetic component were ascertained by those with kinship of greater than 0.2, and then those that were less than 13 years apart. And then after accounting for those with non-missing cognition scores, we were left with about 4,100 pairs, or 8,200 people in total. And then in terms of our we also used polygenic scores, which were constructed for Alzheimer's disease, cognition, and then educational attainment. So this is our main results, and I, of course, don't have all the time to go through this, but if you just look at the first column, it's our full sample. This isn't including the sibling pairs yet, as to be expected. Education is associated with cognition in later life, and then the second and third columns, we opt to use our sample of sibling pairs. It still has that association, but then when we introduce the genetic factors in column 3, there's a little bit of confounding, about 5% in total across the coefficients. And then the fourth and fifth column, we use sibling fixed effects, and if you notice, there's a major shift, about 40 to 50% confounding in the results. And then our next table, we decided to look at selection in G by E. So the first column, we look at education as an outcome, and we input the genetic factors there. As to be expected, the education polygenic measure is associated with education, but Alzheimer's and cognition are not, which makes them good candidates to do a G by E interaction. So you pay attention to the second column where we do an interaction with education. And the Alzheimer's disease polygenic score, it shows that people with a predisposition to Alzheimer's disease have lower cognition, and then this relationship is robust. To the next column where we also input the cognition in the interaction for educational attainment with education. And then finally, just some main takeaways. Our analysis in this study showed that there remains a relationship with education and cognition, even when we did account for confounding due to family background and genetic factors. The main differences is that family background, they reduced the association between educational attainment and cognition by 40 to 50%, more or less, whereas the genetic measures that we use, the polygenic scores, they contributed only minor reductions. And then in terms of some just limitations or directions for future research, we looked at siblings, but we only looked at sibling dyad usage, so we were unable to look at those, say, with more than 2 siblings, or like some with only children, or those with no children. And then and the limitation I alluded to earlier is that a subsample of the UKB has information on cognition, 200,000 out of 500,000 respondents. And then the polygenic scores that we use only account for common variants, not the rare specific genetic